Hi, welcome to Sherman Oaks Medical. We're going to be going over in this video the Hill-Rom Progressa pulmonary therapy surface. So this is a hospital bed frame that comes with this built-in air mattress system. We're going to go ahead and dive in and look at all the different features that this hospital bed offers. So starting from the left side of the bed, the left and right side are exactly identical as far as railing design, button layout, and function. Both of these railings do drop down. Push the green latch there, the blue latch there, drops them down. You bring them back up to lock in place. On our top railing here, we're going to have our buttons that again are exactly identical on the opposite side. So we're going to have our buttons for our height adjustment, head raise, knee raise, as well as two separate buttons for our mattress inflation if we're sitting on the mattress or laying flat on the mattress. So two separate modes that adjust that. So now jumping into some of the more intuitive functions of the bed frame itself. So here we're going to have two separate tablets. One's going to be a digital one with the screen. The other one is going to be our general controller for the bed frame. So we'll start with the general controller for the bed frame. The first thing on the left side we're going to have is our battery backup and our battery life. This does have a battery backup just in case there's a power outage, so you can operate the bed. Starting from the right side here, we have the height adjustment of the entire bed frame. So this is going to raise our bed frame height up and down. Our head raise, knee raise. Over here we have two set functions as far as the length. So if you're a taller individual, you're able to stretch out the leg section. If you're a shorter individual, you're able to bring that leg section more in. As well as an ankle raise, which is a function that not a lot of beds have, especially an electric function, that we're able to just raise that ankle section up only of the bed frame. Jumping into some more of the buttons, the top row here, we're going to have our forward and reverse Trendelenburg buttons here to tilt the entire axis of the bed frame. This boost button is also a reverse Trendelenburg, except this is mostly designed so you could slide your patient up. So what it's going to do is flatten the bed out, tilt it back, adjust the mattress slightly so that way you're able to easily slide the patient back up, because a lot of people tend to slide more down into the bed. This function will help assist you in sliding them back up. Some of the other ones that we have here are going to be our chair button. So this button here, we're going to do a whole separate segment on in a little bit, but it's going to turn the bed into a full-on chair where you're able to stand up and get out of it, as well as the reverse, which is going to take us back from that chair to a bed flat position. So we'll dive into that in a little bit. Now we're going to dive into the digital screen on the device here. So for this Progressa bed, our digital screen is able to tell us almost all of our functions. So right now, we don't have the head raised at all. We don't have the knees raised at all, but we are on a slight tilt back. That's what this -3 is. So we're slightly tilted backwards. So here on the left side, it's going to be our general stuff. That's going to tell us how the bed's condition is now. So we are in Trendelenburg. We don't have any rotation. Our percussion and vibration therapy are off. So that's going to tell us current conditions. Any of the functions that we want to change are all going to be done from over here. So here we have a lot of different functions that we can do. So we could keep the mattress in a normal state, inflate the mattress to be firm, turn right, turn left, deflate the seat if we're going to do that seated function, which we'll dive into in a little bit. If we keep going down over here, these are going to be the two therapy functions. So this bed offers both rotation, where it's going to turn you side to side and rotate your body, as well as percussion and vibration. So if we turn these on, what you're going to see is towards the top here, the bed itself is going to start both percussing and vibrating. So now we're going to go over arguably the most impressive function of the Progressa bed is going to be that they call it chair egress, which is going to allow you to go into a seated position and stand from this bed frame. So the first thing we're going to do is we're going to begin by hitting the button at the top left here. So this is going to begin the chair egress function. One of the things to note, when you're starting this function, you do want to lift your footboard off. We're going to continue holding that button, let the bed go through its motions. So this is going to be one of the only bed frames that's going to bring your legs almost fully down. A lot of other beds offer a chair position, but that chair position keeps your legs restricted and up. These bring you almost all the way up to the ground. So right now we're going to be in that chair egress position. So what it's going to do is our mattress is already going to get softer, so this way it's a firmer surface. So once we're in this chair egress position, one of the other things the bed does is it's going to begin tilting forward. So what this is going to do is mimic the stand. Drop that legs down. Fully chair egress. My legs are down firmly on the floor. Bed is tilted and pushing me, making that stand very easy. Thank you guys for tuning into this in-depth demonstration on the Hill-Rom Progressa pulmonary therapy surface. This is a hospital bed that we do have limited availability for, but we do offer it for rental again to the Los Angeles area in the home environment. If you're someone interested in a bed like this, a bed similar to this, or has any questions regarding it, please feel free to give us a call at 818-981-9906 or visit our website at www.shermanoaksmedical.com.